Thank you for joining us for our latest media briefing on important healthcare issues in the news. My name is Dr. Andrew Park, and I'm the president of the Ontario Medical Association, which represents more than 43,000 doctors across the province. In less than 2 weeks, children in Ontario will be returning to school, and will they be returning to an even greater sense of normalcy than last year? The vast majority will be in school, in person. They likely won't be required to wear masks or follow social or physical distancing precautions that were necessary to prevent the spread of COVID-19. For many children, this is still a new experience. For much of the past 3 years, they have done some form of remote or hybrid learning and experienced some form of lockdown or restrictions on who, where, and how they could play. How did the pandemic affect our children, not just in terms of their education, but also their mental health and social development? Today, we've gathered a panel of medical experts to look at what a return to normalcy might look like for the coming school year, and whether that could be derailed by the resurgence of the triple threat of respiratory viruses, the seasonal flu, COVID, and RSV. According to the latest Public Health Ontario data, levels of COVID-19 and influenza are both currently low across the province. But historically, we see these viruses increase in the fall as temperatures drop and people spend more time indoors. In Canada, we look to the Southern Hemisphere to see what our flu season might look like. Australia had one of its busiest flu seasons in years and saw a surge in hospital visits by children experiencing severe flu symptoms. At the same time, a highly mutated variant of the COVID virus has popped up in several countries and is being closely monitored by the Public Health Agency of Canada. This new variant is likely a descendant of Omicron, which sparked a wave of infections in spring 2022. And while there is a new vaccine for RSV for Canadians over the age of 60, last winter was an especially bad season for RSV in the country, specifically in young children. Our experts are going to talk today about the importance of vaccinations, which we know are one of the most critical initiatives that can help prevent the spread of these illnesses. And finally, we're also going to talk today about how much time children are spending using screens. According to recent research from Media Smarts, which is a Canadian nonprofit organization that focuses on digital and media literacy programs and resources, parents report that about 36% of their 10 to 13-year-olds spend 3 hours or more per day using digital devices for reasons unrelated to schoolwork. That's at least 21 hours a week. The Canadian Pediatric Society warns that when children are on their devices, they are usually not learning, interacting with friends and family, playing, or enjoying the outdoors. Solitary screen time also increases the chance that they'll be exposed to negative or harmful content. I'd now like to introduce my physician colleagues who will discuss each of these topics. Dr. Vinita Dubey is Toronto Public Health's Associate Medical Officer of Health. Dr. Richa Agnihotri is a community pediatrician in the Niagara region. And Dr. Katherine Matheson is a child and adolescent psychiatrist at Children's Hospital of Eastern Ontario and a member of the Canadian Pediatric Society's Digital Health Task Force. I'm now going to hand things over to Dr. Dubey to talk more about the potential impact of respiratory viruses on the school year. Dr. Dubey, as we head into the fall, what can we expect in terms of COVID, flu, and RSV? And what should parents and kids know about best practices for masks and booster shots?
Okay, well, thank you, Dr. Park, and thanks for having me. I mean, I think the one thing that we certainly recognize through the pandemic is how important it is for our children and students to attend school in person. And the goal now in the coming years is to recover the losses from the pandemic. And so this includes things like learning losses, but also things like getting students caught up on vaccines they may have missed due to the pandemic, and also keeping them in school so that they're healthy. So what we can expect this fall is that respiratory viruses will increase. I mean, as you noted, they increase every fall. But similar to last fall, we are especially preparing for what some have called the triple-demic, RSV, influenza, and COVID to all increase at about the same time. Now, we know that RSV and flu, those two viruses, can be more serious in children, especially young children. And what we've learned from the Southern Hemisphere, in particular from Australia, from New Zealand, is that children were more impacted by influenza this past season. But we also learned that the influenza viruses strains that circulated were a good match with the vaccine. So parents can add to their list getting the flu vaccine in the fall. It usually comes out in October or November. And in particular, getting their children vaccinated, you can give the flu vaccine as down to 6 months of age. And that will be really important to keep children from getting very sick from the flu. Now, we talk about, well, this is the first year since the pandemic has been declared over uh, for going back to school, but COVID is still here and it will be with us. So we can expect new variants. We're hearing about new variants. That is what we expect. There will be an updated booster in the fall. What we think it's going to be an XBB type of booster. It will be available for adults. It will probably also be available for children. We'll wait to see what has been approved by Health Canada. And getting that fall COVID booster will help to enhance our immunity to prevent getting very sick from COVID. Now, we know that many people have gotten COVID, many people have been vaccinated, but we know that it's been some time now for a lot of our population, and that immunity is waning. And so that is going to be the reason to get that fall booster when we expect, again, as we go indoors and as the virus has a really good chance to spread, that we'll need that added protection. So with each new variant, there can be differences also in its impact on different ages and how serious that COVID variant is, and also on long COVID. And I think we need to remember that while children may not have gotten very sick from COVID, they can still get long COVID. And long COVID in children can present with symptoms of poor concentration or fatigue. And we know that the vaccine is safe and can prevent long COVID. So that's something else that I will keep in mind. The flu vaccine and the COVID vaccine can be given at the same time this fall. Now, let's also finally not forget those preventative measures that we've learned and that we reinforced during the pandemic. They still work. So if you're sick or your child is sick, staying home while they're sick will help to prevent it from spreading. It will also probably help them to get better. Now, washing our hands often will be really important, covering our cough, spending outdoors, time outdoors as much as possible. Again, we can't lose that. That still is a good measure. And then recognizing that we need to take extra precautions if we are at higher risk. So if we have a weak immune system, if we are a senior, or if we are around our loved ones, maybe are seniors or have weakened immune systems, we can protect them or ourselves further. And that's where masks are something that we need to consider when we're at higher risk, maybe if we have symptoms, to protect those around us, and especially when there are a lot of viruses circulating when we're in indoor crowded settings.
Sorry, muted. Thank you, Dr. Dubey. I'd now like to hand things over to pediatrician Dr. Richa Agni-Hotri. What are the top challenges kids will face this school year? What advice do you have for parents to help kids readjust to the new normal this year?
Thank you for that great question, and thank you for having me here. So just to kind of go back to the, take you back to the time when COVID was kind of starting out, the COVID disease, the complications associated with the disease, the pandemic measures, including lockdown, which caused, children to go virtually or in person and sort of back and forth. This impacted their routines significantly, and this also impacted relationship dynamics that children had with themselves, with their caregivers, their teachers, and their community and peers at large as well. So this did result in other issues. For example, the top three things, I mean, there are a plethora of them, but the top three I would say is we've been seeing a rise in mental health concerns, including anxiety, other development concerns, such as academic challenges, including literacy concerns, difficulties with social and emotional development and resiliency, as well as adjustments to routine changes as we move from a sort of unpredictability to a little bit more of a predictable routine. So just going with that sort of background, I also want to highlight that every child, although there are some general themes, every child is independent and individual. They come into the world with their own temperaments, their own personalities, their own genetic makeup, and then they exist in an environment of their own home, their own socioeconomic status, their race, among other factors. So while there are some general themes that can be drawn, it didn't impact every single child the exact same way. And as such, the things to think about for parents going into the new year is, number one, meet the child where they are. Where are they developmentally, academically, socially? Anticipate some challenges that may arise from going from the summer routine to school year and their specific needs, and then help them to gain some tools in their armory to overcome some of these challenges. So what you can also consider is recruiting help. For example, the help of your doctor, teacher, community at large, if needed. Secondly, create a predictable routine that is consistent in all environments, so your child feels that sense of security. One way they can benefit is by having a visual schedule, for example. The routines can actually help them feel safe, secure, and build their resilience. So one thing that comes to mind is having a predictable routine if your child stays in several environments. In every environment, you want to keep it as consistent as possible, whether it's the morning routine, after school routine, mealtime routines or bedtime routines, and ensure that sleep is a top priority, because children do need to have good quality and quantity of sleep in order to enhance their development, learning, and overall growth, health, and well-being. And then lastly, remember that a healthy relationship between you and your child is very, very important for your child's health, their well-being, not just in the short term, but in the long term. The things that we say as parents, the things that we do, these can leave lasting impacts. So spend quality time daily with your child. And we're talking quality, we're not talking quantity. We know a lot of us are very busy and we don't have all the time in the world, but you want to make sure that the time that you do spend with your children is quality time, whether it's on the way to school, from pickup, at the dinner table, at bedtime. Allow your child the space in a non-judgmental place to talk and share their views and their experiences. And as you attempt to listen and connect, before you advise or correct whatever may the situation may need. And in doing that, you may actually be able to pick up areas for concern and then advocate for them. For example, if you're concerned that your child might not be reading yet, that's something that can arise if you've built an open communication and that feeling that your child feels supported by you. And should these concerns arise, of course, bring it up to your child's doctor or teacher.
Thank you. What a great message. I'd like to hand things over to Dr. Katherine Matheson, a child and adolescent psychiatrist and a member of the Canadian Pediatric Society's Digital Health Task Force. Dr. Matheson, what lasting effects did screen time during the pandemic have on our kids? And what are the current guidelines for how much screen time is acceptable?
Thanks so much for the question, and thank you for having me. We know that families having and raising young children have been among the most severely impacted by the stressors of the pandemic. Screen time has increased in children of all ages as families have increasingly relied on electronic devices for everything from entertainment to education. A recent study from Ontario showed that the current screen time use has doubled compared to pre-COVID levels, which is not a surprise. In addition, during the pandemic, parents were often physically present at home, but not available to engage with their children because they were working virtually, which was confusing for many young kids. The increased dependency on screens during the pandemic has sparked discussions among teachers, parents, and healthcare professionals regarding the possible long-term effects. In a time where screens have become the norm and is considered an electronic babysitter, it's crucial to make parents and educators aware of the risks of excessive screen exposure. and help guide parents on how to mitigate these potential risks. We do know that children's brains develop in the context of safe, stable, nurturing relationships. That means that they learn best from face-to-face interactions with caring adults, and screen time is often a lost opportunity for these quality interactions. Too much screen time can increase your child's risk of becoming overweight, slow language skill development, early reading skills, cause nearsightedness, sleep problems, and present difficulties in learning to regulate their emotions. So while the implications of excessive screen time during COVID can be alarming, there are ways parents can mitigate these potential risks associated with it. The Canadian Pediatric Society's recent position statement on screen time introduces 4 evidence-based principles called the 4 M's approach: minimize, mitigate, use mindfully, and model healthy screen habits. So the first one, you can minimize screen time by setting screen time limits. So the CPS recommends for children between the ages of 2 and 5, no more than 1 hour of screen use daily, and none for kids under the age of 2. It's really helpful if families can designate tech-free zones during family meals and other gatherings to promote that bonding and face-to-face interaction. Also consider turning off screens at least an hour before bedtime to improve sleep quality. We can mitigate screen time risk by promoting those face-to-face interactions over screen use. One easy way to do this is by introducing 5 minutes of special time per day, where as a parent, you put away screens and spend one-on-one time with your child for 5 minutes following their lead in play. It's amazing how quickly this will improve the quality of your relationship with your child. If they are on screens, do your best to choose creative or educational apps or interactive learning games. Mindful screen time use can occur by co-viewing content or playing video games with your child. That shows interest in what they're doing, and it also will increase connection and make it easier to end screen time when their limit is up. Mindful screen use also includes engaging in open dialogues with your children about online safety. As parents, we can model healthy screen time by participating with our children in activities beyond screens. So getting outdoors, baking, shared reading, board games, and crafts. As adults, we should ensure devices are turned off when not in active use and really minimize that background TV. Parents' screen time is directly correlated to our children's screen time. And we know that when adults spend too much time on devices, kids can often act out and really seek that negative attention. So keep in mind, these guidelines are not intended to make parents feel guilty. For example, last night, I put my 3 young kids in front of a TV show with 0 educational value for over an hour so I could finish up this research on the potential risks of excessive screen time. We're all doing the best we can as we continue to navigate out of these unprecedented times. But as September nears and children gear up to return to school, fostering these healthy habits becomes essential. And this transition period offers a great opportunity for parents and families to reevaluate and set screen time boundaries.
Thank you, Dr. Matheson. I think as parents, we can all relate to that experience. I'd like to thank our panel for sharing their expertise. We are now going to open our Q&A session. The OMA's Emily English will moderate the portion of today's briefing. Please put your questions in the Q&A chat. And as always, if we don't get to your question, the media team will follow up with you. You can also email media@oma.org with requests for interviews or information, and we will have a recording of this session available later this afternoon. Emily, over to you.
Thank you, Dr. Park. And the first question is for OMA President Dr. Park. It comes from Marjo John with the Medical Post. She's asking, how can doctors get ready for a potential tridemic or triple threat of respiratory viruses?
Yeah, thank you for that question. I think that doctors really need to get prepared, just like our general public. That includes ourselves, ensuring that we get our vaccinations. But from a practice standpoint and from a provider standpoint, is to ensure that our primary care physicians and our primary care, whether it's pediatrics, family physicians, have a stable supply of their vaccines and ready to go, that they have a supply of their personal protective equipment to ensure that when their patients are sick, that they are protecting themselves. And mostly, these are really tough times, like certainly as I'm talking about the flu surges and the viral surges throughout the winter. And I know, speaking as an emergency physician, there's a lot of burden on the system, and we feel that acutely. So it's to take care of one another. Sometimes we overextend ourselves, we get a bit tired, we don't those things like simple behaviors like washing our hands and ensuring that we're doing the best that we can to take care of ourselves, those tend to lag behind. So it really is a message about to our physician colleagues to ensure that they're doing what they can to take care of themselves also.
Thank you very much. We have a question for Dr. Vinita Dubey. Dr. Dubey, during the pandemic, there was a big focus on the message of if you're sick, stay home. So as we head into the school year, what should parents know about keeping their children home when they're sick?
Yeah, thanks for that question. Really, that message needs to continue. So really, if you are sick, stay home. And really what we're talking about, if your child has a fever, if they have a new or worsening cough, if they have respiratory symptoms that can spread to others, vomiting and diarrhea are also ones to keep your child at home. And we had tools in place that are actually still in place. So the province still has a screener tool to help guide parents on the symptoms their child has, when to keep them home, how long to keep them home for. And the goal here really is to not to keep them home indefinitely, but really the guideline is when their symptoms are improving for 24 hours, then they can return back to school. And there may be a role for wearing masks if someone has symptoms. Maybe they tested positive for COVID and their symptoms have improved, but to mask, especially around vulnerable individuals for that shorter period of time.
Thank you very much. And we have a question about screen time. So I'll direct this to Dr. Katherine Matheson. This one comes from reporter Joanna Widner with the Waterloo Region Record. How can parents make it easier for children to accept limits on screen time?
Oh, that's $1 million question. There are certainly things you can do to make it a bit easier. One of the Canadian Pediatric Society guidelines on sort of the mindful screen time use. So if you choose to participate in screen time use as a family, and you're watching a show or you're engaging in a game with a child, you sort of know when it ends and when that natural transition might be, which is sometimes easier for kids to accept. Also talking about things in advance, coming up with a family media plan where everyone's aware of what the screen time limits are, and sort of you troubleshoot with your child how to manage that transition so that they don't become dysregulated can be helpful. And ultimately, there's lots of technology now that actually allow parental control on the amount of screen time, so that I learned this last night that the iPad will shut down after sort of that hour is up and the child can't access it anymore. So there's a few different ways to get around that. That being said, if there's problematic screen use and your child's having a really hard time transitioning off screens, that might be a good time to check in with your primary care provider or your local pediatrician, family doctor, to get some more helpful hints about how to make those transitions easier for the whole family.
Thank you very much for that question. And we have another question for Dr. Vinita Dubey. This one comes from Alan Hale, who's a reporter with Queen's Park Today. From a policy standpoint, what should the province be doing to make sure schools are safe and virus levels are kept to a minimum, and has the time for masks completely passed?
Yeah, thanks for the question. So, I think that we have learned a lot through COVID. And so having soap in the soap dispensers at schools, making sure that we have running water, hand sanitizer readily available. I think those are things from the pandemic that have carried on, including doing more cleaning of commonly touched surfaces. Also that, push to spend as much time outdoors as possible is something else that we've learned. We have not thrown the masks out by any means. We just are recommending that we use it based on the circumstance. And so really when we had mask recommendations in place, it was because the risk was very high. And that's something that we can see into the fall and winter as well too, that as the risk increases, if you individually have a higher risk, that you may take more precautions as well. And so the role for the mask has not gone, but it is what we might call a risk-based approach in terms of its use, based on the current risk for the population and then based on your own individual risk as well.
Thank you very much. And we have a question now for Dr. Agnihotri. Why is literacy such a sensitive marker for a child's development? And if a child is lagging behind, what should parents do?
That's a really important question. So thanks for that great question. Literacy, so the ability to really read and comprehend what a child is reading is really important. So much of our learning is based on our ability to read and comprehend. So we're talking about just, signs. We're talking about health literacy. We're talking about school readiness, performance at school, and then jobs later on. So literacy is extremely important. And a study recently showed that children up until grade 3 are learning to read, and then from grade 3 onward, they read to learn, and that 75% of children don't catch up beyond that time. So it's a really crucial window that children really have to be able to read by the time they're in grade 3. And there are many different things that we can do as parents, as healthcare providers, as teachers to encourage that. It starts from expecting a child when you're pregnant, reading to your child when they're born. It's never too early to start reading to the child, building some literacy skills. They start to learn how to use books. They may just play with board books initially, and then you show them how to read sentences slowly by breaking words down. A phonemic awareness, which is the parts of words being put together. So without going into too much detail, so if you are concerned, bring it up to your child's doctor, teacher. And if your child is under the age of 4 in Ontario, if you have speech-related concerns, for example, you can actually self-refer to be assessed by a speech and language therapist in many parts of Ontario.
Thank you. And another question for Dr. Matheson. As a child and adolescent psychiatrist, are you noticing more mental health concerns in children post-pandemic?
The short answer is yes. Certainly across the board, presentations of children presenting with severe mental health issues are increasing. So in our emergency department, more children are presenting with suicidal ideation and risk. On our inpatient unit, the rates and prevalence of eating disorders has gone up, depression, anxiety. I work at a school-based day treatment program, and certainly kids in kindergarten, grade 1, grade 2 are presenting with mental health symptoms in rates that we have never seen before, as well as even kids under the age of 6. Parents are noticing huge challenges. And again, that makes sense with the cohort that was young during the pandemic. A lot of those children haven't had access to quality childcare, social learning opportunities, and have grown up with really stressed out caregivers. So we're noticing a lot of mental health symptoms, regardless of age, regardless of diagnoses. It's definitely a youth mental health tsunami right now, and I expect that's going to continue.
Thank you very much. And we have another question from Joanna Widner with the Waterloo Region Record. I'll direct this one to community pediatrician Dr. Agnihotri. Do you think all children will be able to catch up on skills that didn't develop as usual during the pandemic due to the disruptions?
That's an excellent question. Thank you for that. I think, the difficulty is in saying all children. As I alluded to earlier, every child, comes in with their own temperaments, genetic makeup, developmental state that they're in, and the environment that they have around them. So the level of support from an equity standpoint is going to vary depending on each particular child. So it is important for communities to recognize that and to meet children again where they are at, so that each child is taken independently. And some children may need less support, while others may need more support, whether it be from directly their caregivers or the community at large, including their healthcare providers and school and other developmental services. So I think it's very difficult to kind of say that there's a blanket all, but some children may need more support than others.
Thank you very much. And a question now for our OMA President, Dr. Andrew Park. Dr. Park, you're an emergency physician in London, Ontario. Can you talk about the strain that you saw in the system during last year's respiratory season?
Yeah, thanks for the question. Certainly when you're in an emergency department, this is a location where people can get care 24/7, and certainly parents and family members and the elderly and just the general population really struggle during this time because of the impact on their health, their personal and professional lives, and that's where we come in as emergency department providers to ensure that they are healthy and that they are able to go back out into the community versus requiring inpatient or to come into the hospital for a stay for a few days. And this can be incredibly stressful for caregivers as well as patients themselves. And it puts an incredible strain on the system. And that's why I think that we've really highlighted today through Dr. Dubey's message around the importance of preventative care and vaccinations and what that can do to alleviate our system, as well as she alluded to, protecting our vulnerable segments of population. So, for all emergency medicine providers, this is kind of that time of season where we know that the strain on the system will go up significantly, and hence the importance of the public health measures that she's described.
And a question now for Dr. Vinita Dubey. Are we expecting this fall and winter to be as busy as last year in terms of the triple threat of respiratory viruses?
Yeah, the one thing that we have learned, it's really hard to totally predict what to come, but we take our lead from what's happened in the Southern Hemisphere because their winter is before ours. And they certainly have had a busy season with those three viruses. And we did see that again here last year as well, too. So we are expecting this fall to be a heavy respiratory virus season. And in particular, with those three respiratory syncytial virus, RSV, influenza, and COVID, among the other viruses that also spread at that time.
Thank you very much. And a question now for Dr. Agnihotri. This one's from Joanna Widner with the Waterloo Region Record. Many parents will likely be anxious sending children back to school with fewer prevention measures in place. So what's your advice to them to make the transition easier?
Thanks for another great question. So really, I think one way is to target the mindset, might be looking at your own mindset and looking at your child specifically. Do they get anxious about routine changes and things they don't know? Many children do. I do. So it would be, very prudent to anticipate some of those changes and then speak to your child one-on-one to see what do they understand of the changes that are to come and where may their gaps potentially be, and to give them that information only in small amounts based on what they are grasping and understanding, and then allowing them to kind of ask the questions and answer accordingly. You want to cater this towards your child's specific temperament and their development and understanding as well. And of course, if there are academic questions or challenges, it may also help to sometimes meet with teachers, with the student as well, with your child as well, to figure out a plan to maybe help with adjustment to some of these changes. So it's going to look very different depending on if your child is starting school for the very first time compared to if they've been in school, if they're an older child or they're an adolescent as well.
Thank you very much. And another question for Dr. Park. Can you talk about the importance of vaccinations and why it's important for everybody to get the flu and COVID vaccine?
The short answer is because they work, and we've seen them be very effective in preventing, both the number of people as well as the impacts of the viruses on their health if they are to get sick. It's also an opportunity to have a touch point with your physician where you can kind of discuss what your ongoing healthcare needs are in that moment, as well as what you're kind of anticipating over the next few months. Again, as we talked about from an emergency medicine perspective, being in that environment and seeing our most vulnerable impacted, I think that is also another reason why it's really important to stress the message around vaccinations. It's not just about me but it's about all of us as a community and how we experience illness. And I think it's really important that we keep that in mind.
Thank you. And another question for Dr. Dubey. Historically, have COVID and flu vaccination rates for children been as high as they should be?
No. So we know that for COVID vaccination rates, those 12 and older had very, very high vaccination rates. 5 to 11s were next, but we know that our youngest kids really didn't get vaccinated for the most part. So, and we also know for flu vaccines that in general, children tend to have lower vaccination rates. Now, we do know in particular that flu can be very serious for children, and the flu vaccine is safe, and it seems to be a good match, at least in the Southern Hemisphere this year. So, going into the fall, I would really recommend that parents get the flu vaccine for their child. The COVID booster will likely be just one booster for everyone based on the age that it's authorized. And so those two vaccines can be given at the same time.
Thank you. And another question for Dr. Matheson. In your opening remarks, you mentioned some of the health impacts of increased screen time. Do you think we've seen the full extent of those health impacts in children yet? And can you expand a little bit on what they are?
Thank you for that question. I think we've really just seen the tip of the iceberg in terms of those health impacts. Much of the data is looking at long-term implications. So when I was alluding to future metabolic health and myopia, those are all things that are sort of long-term implications that develop sort of with habits that are formed early. We also know that brain development really occurs in the context of the relationship. So screens are interrupting the ability of those skills to develop from the bottom up, and can have a direct impact on things like executive function, which is responsible for the attention and what many people think of as ADHD symptoms. So the good news is that it's never too late, even just being aware of screen time guidelines and knowing that anytime a child is presenting with a mental health symptom or those negative health implications from too much screen time, really the antidote is the relationship and working on that caregiver-child interaction and promoting that relationship through activities together or spending quality time together with no screens. It's never too late to sort of repair that or pull back on the amount of screens that your child is engaged with.
Thank you. And another question for Dr. Agnihotri. In what ways may less socialization during the pandemic have impacted children, and what are ways to get children back on track?
Thanks for another great question. So certainly, with the lockdowns, children did lose that that environment in which social skills could have potentially been laid down, on which they will then provide the foundation for future social skills to then be built. But the brain is also quite malleable in a sense. We talk about neuroplasticity. So and a lot of these connections that are being built in the brain in the early years can actually continue to mold based on the experiences they then continue to experience. Sometimes it's sort of in terms of the connections in the brain, it's a use it or lose it sort of situation. But for the most part, in the early years of development, children can actually start to learn skills that they may not have been exposed to in the earlier period. I'm talking, say they were 0 to 2 compared to when they're older. So that, in a nutshell, if you start to socialize them, they will start to build those skills back again. And again, every child is going to be different, and what that support looks like, it's going to be very different. If you have a child who has had increased developmental needs, so for example, children who may have had speech delay that could have been exacerbated by the pandemic and not being able to access services appropriately in a timely manner, then that child may need some additional support going forward into the school year.
Thank you very much. And a question for Dr. Park. A lot of concerns that parents may have early on might first go to a family doctor. What work is being done to ensure that everybody in Ontario gets a family doctor?
Yeah, thank you for that. We, in 2021, we released our prescription for Ontario, which is a 5-point plan for making the healthcare system improved. And one of those was certainly to ensure that every person has a team of physicians that are linked. And this year we've released our progress report with a very big concentration on our primary care and how we ensure that every Ontarian, of which there are up to 2.2 million Ontarians without a family doctor, do have a family doctor. That links in with a lot of the conversations that we're seeing today around preventative medicine and vaccinations, and ensuring that we have critical conversations, as Dr. Matheson has brought up, around how are we using our screen time, and the things that Dr. Agni-Hotre is talking about. But are we getting enough sleep, and are we eating well, and are we ensuring that we have the things that we need to ensure a healthy population that continues to grow and develop. So that's been a real big part of the work that we're doing at the OMA around our recent progress report, with highlighting that to our government partners to ensure that primary care is a key focus for healthy communities.
Thank you very much. And another question for Dr. Matheson. You've talked today about mitigating some of the effects of too much screen time for children. What resources are there for parents to know what is the proper amount and how to go about mitigating those risks?
That's a great question. My go-to is typically the Canadian Pediatric Society. They have some really nice practice parameters, but also some information for parents with really nicely laid out bullet points with concrete examples of things that you can do. There's also sort of some common sense media advisory panels, but honestly, CPS has all of the links to all of the screen time related research, how they came up with those numbers, and different ways to sort of mitigate those risks. So I would start with the Canadian Pediatric Society as a parent.
Thank you. And Dr. Agni-Hotre, another question for you. If a parent does have concerns about their child's development, when is it time to speak to their teacher, and when is it time to speak to their doctor?
Thanks for another excellent question. As soon as you do have a concern as a parent, bring it up as soon as you sense that concern. Bring it up to your child's doctor or the teacher, depending on the age or stage of the child. And often, like I spoke to a little bit earlier, if there's specific development concerns and your child is under the school age, so under 4, you can even make self-referrals to developmental institutions near you to start services while you're waiting for a family doctor or pediatrician appointment as well.
Thank you very much. And another question for Dr. Park. We talked today about the triple threat of respiratory viruses that put strain on the healthcare system overall. We saw that last year, especially. What system level solutions are needed to ensure our healthcare system has enough capacity in the future?
Yeah, I mean, that's a large part of the work that we're doing at the OMA, to have a look at what system level solutions can we advocate for on behalf of physicians and our patients to ensure that our system is able to experience fluctuations in mass fluctuations in healthcare, particularly epidemics and pandemics, and how we respond to that. I'd say a few things. Certainly the linkage with primary care and ensuring that we prevent illness and disease, and how we prevent those things, even like to the extent of chronic illness, that allows our system to flex and be able to handle those other fluctuations in a very different way. But really, and Dr. Dubey can also comment on this if she'd likes, but certainly the public health aspect of things, the need to invest in the infrastructure, to have the data to analyze and make the decisions in a more rapid sense around how we experience viral flu season, COVID, and other viral infections that we know are going to come at a fairly predictable time. Being able to anticipate, coordinate, and make decisions based on the data that we gather is really important for a properly functioning public health system.
Thank you. And a reminder to media that you can put questions in the Q&A. If we don't get to your questions, we will follow up with you, or you can follow up with us, always media@oma.org. But please, if you have any questions to add to the Q&A, please do so. Another question now for Dr. Dubey. What's the latest advice about when people should get COVID boosters? There has been some suggestion that maybe people should wait until the fall.
Yes, I would say wait until the fall, because we are expecting an updated booster to be available, and it will be an XBB strain, and that's currently being worked on. It will be approved by Health Canada and will be made available. So that's really why I would recommend that people wait for the fall. It will also give them that protection when we expect the virus will increase further in the fall.
Thank you very much. And another question for Dr. Katherine Matheson. You spoke a little bit about some problematic behaviors of kids when they are using screens too much. Can you elaborate on what those are, and when parents should be noticing that there might be some problematic behavior around screens?
That's a great question. Some of the sort of warning signs that I recommend watching for that are clues that screens are becoming a problem are if your child is complaining about being bored or unhappy if they don't have access to technology. If there's oppositional behaviors or emotional dysregulation when you try to set limits on their screen time use, that can be a clue that things are becoming problematic. If screen time use is interfering with sleep, attending school, or actually engaging in those face-to-face interactions with caring adults, if screen time is interfering with physical activity, whether it's getting outside or getting sort of the recommended dose of physical activity, as well as if it's interfering with socializing with family or friends. And anytime there's sort of negative emotions tied up with online play, video games, texting, that's really a sign for parents to sort of monitor things more closely, or sit down with your child and make some changes.
Thank you very much, and thanks to all our panelists today. I'm going to pass it back over to OMA President Dr. Andrew Park, who has some closing remarks.
Thank you, everyone, for attending today's briefing and for your very thoughtful questions, and to our panelists for your excellent responses. As doctors, we want our patients to get the care that they need. The past few years have brought an unprecedented strain to our healthcare system. The OMA has a roadmap for the future in our prescription for Ontario, which is Doctor's 5-point plan for better healthcare. But what everyone in Ontario can do is to make sure that they get vaccinated for COVID-19 and the flu this fall, and stay home if you're sick. We all need to do our part to ensure we keep ourselves and those around us healthy and keep pressures off of our hospital. With that, we'd like to wish everyone a safe and healthy start to the school year, and thank you, everyone, for your time.